So whiplash injuries are very, very common. In the UK alone, there is about 500,000 whiplash injuries per year. And they do lead to significant costs. So we do know it causes about £5 billion in costs to the UK alone. So that is a massive problem. Generally, whiplash is not considered to be a nerve injury. But our research now shows that indeed some people who have a whiplash injury do seem to have nerve problems. And we believe that this might have to do with a neck injury that causes during the trauma that might either cause strong traction on the nervous system or immediate compression on the nervous system. So in nerve injuries, in whiplash, but also other nerve injuries, what we would usually see is that patients often get pain from it. That could be tingling, but also burning pain, electric shock-like pain. Very often we also do find signs such as numbness or weakness in motor strength, and the reflexes are often absent. But quite importantly, it's not just about the pain, but sometimes it's also what impact that pain has on other issues. So for example, it can massively impact on quality of life in these patients. It can also impact on their emotional well-being. So for example, it can cause anxiety or depression. In our study, we basically looked at patients in the acute stage after whiplash injury, so within 4 weeks, and we followed them over time to 6 months later. And then we looked who did recover and who did not recover, and do we find nerve injuries in the acute stage, and could these nerve injuries predict who does or who doesn't recover. So our early data from this study shows us that there is very clear evidence that some patients with a whiplash injury seem to have a nerve dysfunction. And we do know that repetitively from different methods that we have used. So for example, we find numbness, we do find nerve-related pain, we find specialized tests such as quantitative sensory testing to be abnormal in these patients. And importantly, we also find a blood marker for nerve injury to be changed right after whiplash injury. We do hope that our findings will eventually help us targeted better treatments to the right patients much earlier, so that hopefully in the future we can prevent so many people developing persistent pain after whiplash injury. So the Emerging Leaders Prize in Pain Research has made a massive change, not only to my research and obviously enabling us to answer very important questions and eventually making an impact for our patients, but it absolutely has shaped my career. I would argue it has helped me progress in my career, getting additional funding, building networks internationally as well. It has also helped people that I have employed on the Emerging Leaders Prize to shape their careers. So a massive thank you to the donors who make all this possible, that what we are doing in our team. It's really quite humbling to know that there's so many people out there who believe in science and the change that science can bring also to our patients. So a massive thank you.